Yeah. And I mean, the thing that is both remarkable and sad about it is that it's sad that it took needle exchange for us to realize that if you're kind to people, they start to be better to themselves. I mean, it's sad that it is like when you go and you see harm reduction in action and you see these people who are the despised people of the earth being treated with respect and suddenly coming alive in a way that they weren't previously. It's like, why would we think that being cruel and exclusive towards people is going to help them?
That was my guest this week, Maia Szalavitz, and you're listening to the Recover Yourself podcast. I'm your host, MartinJon, and I'm interested in broadening the scope of how we understand the word recovery. For me, recovery means moving to a place where you love yourself more. Obviously, that doesn't have anything to do with specific substance or behaviors, nor does it matter where you are right now, only where you're headed, which is why I see recovery as being for each and every one of us. I'm speaking with Maia today about harm reduction, which has a rich history, and Maia has been a leading part of that all along, first as a receiver, then as a supporter. Her new book, Undoing Drugs, is a history of harm reduction in the United States. We cover a lot in this episode around what harm reduction looks like and why it is such an important conversation to be having. Because the drug policies we have today, unfortunately, were built to do harm to people and communities, mainly to make a point. But if you're to weigh the importance of someone's point versus someone's life, I hope you can see where your allegiances should lie. Maia, thank you so much for joining me. I am so excited about you and Undoing Drugs.
Oh, thanks so much for having me.
Undoing Drugs is the history of harm reduction kind of in the world, yeah?
I mean, well, it's really United States and Eurocentric. There is a whole other history in other parts of the world. I feel very bad about leaving out some really great activism by people in Australia. And then whole continents like Africa and Latin America, but I had to do that because I had to start somewhere and I didn't want an 1,000-page book. And even just focusing on primarily the US, with some detours into where it starts in Europe and some amazing work in Canada, that could have easily been 10 different books. So part of the challenge of writing this was really just being very narrowly focused and realizing that that was going to annoy a lot of people, but hoping that other people would write a specific history of all the little parts of it that I had to condense and not, explicate as fully as I might have done.
Yeah.
But it is, I believe, it's really the first history of harm reduction in the US for sure, and within the UK to some extent.
And let's be honest, like the United States really leads the way in at least studying of addiction. And so like, I mean, it seems to me, I don't know.
Well, I mean, actually, yeah, the National Institute on Drug Abuse, which is our federal research agency, is the single biggest funder of addiction research in the world. So that is accurate. We also lead the world in promoting the drug war, although Russia is picking up that role a bit more now. But it was very important in the Cold War to have something we could agree on. And drugs are bad was the thing that was chosen. And that had horrible repercussions for the lives of people who use specific drugs that they decided are bad.
This is so like, okay, so we're talking about harm reduction and in policy, we have promoted and really pushed a lot of harm. Where do we start to, like, at least as individuals, start to unpack that so that we can open up a doorway to harm reduction that is accepted by so many people? Because so many people want to shut it down just because they think it should be hard for some reason, or it should be uncomfortable, or it's, I don't even know how to.
Well, I mean, I think the reason is that the idea of the drug war is that if we stigmatize drug use and punish drug users and attack people and break them down. They will hit bottom, and then they will get into glorious abstinence recovery, and everything will be great, and children won't use drugs anymore because they'll see how degraded those people were, and they'll see their deaths, and they'll know, oh, I don't want to do that. And it's completely based on a series of fallacies. And it's also based on racism, because the drugs that are legal are not legal because they're safer. They're illegal because white men in power preferred them and preferred to sell them.
And welcome to legalized cannabis.
Well, I mean, yeah, to be fair though, like cannabis has been one of the biggest thorns in prohibition, in the sense of that it is clearly less dangerous than alcohol or tobacco, and it clearly undermines their argument. So by bringing in marijuana, you might unfortunately support some prohibitionist arguments, but I don't think that's actually where we're going, because I think that what people have realized is that if sending the right message is the goal of the drug war, then the goal of the drug war has to be to do harm to people, to send that message.
Right.
And harm reduction says, no, the problem is not drugs, the problem is harm. So when you frame it that way, it completely flips the morality of the situation, because you have one side that's trying to harm people for their own good, and the other side that's saying, we just want to reduce harm. And that's a much more pragmatic and compelling and moral argument, I believe. And so the moralizers who were all on about the evils of drugs and the immorality of drugs have a very difficult time with harm reduction for exactly that reason.
Right. And then well, because now we're in a cycle of this is the right thing to do for somebody. We have this idea that it's right to be harmful.
Right. And that, I mean, to me, that is the biggest problem with our treatment system and with our criminal legal system and all of that. It is just focused on the idea that if we hurt you, we'll help you. And that's just sadism. That is not okay. And who are we to say that, like, we know better? And when you actually look at the data, and this is again why harm reduction is so threatening, it shows that being kind to people helps them be kinder to themselves. It doesn't increase their self-destruction. It doesn't prolong addiction. In fact, if you prescribe heroin, the people who are prescribed heroin, as opposed to those who are like left on the street using street heroin, they're more likely to become abstinent, which, you know, now that is not the goal there. The goal is to stabilize people. And if they get abstinent, great, but it's just the goal there is harm reduction. But the point is that people always have this idea that if we enable people, if we make the lives of people who use drugs good, then they will, have to stop. And the problem is, the reason people are using drugs is because they're in pain often. And so adding more pain does not solve the problem, nor does simply taking away the drug, because if you don't solve whatever the problem is the person's trying to solve with the behavior, they're just going to find other compulsive behaviors. And so some of them may be less harmful, and that could be a good, it's really good if we get somebody to go from like injecting heroin every day to like smoking pot every day. That's like a win in harm reduction, and it's a win for the family. It's a win for the risk of mortality. It's a win in all kinds of ways. But in the prohibition world and in the abstinence only world, that person is just as much a failure as if they continued shooting up 20 times a day. So this is why I wrote this book.
Yeah, absolutely. And we need it. Like I said before we even got on, I was like, this is the book that we need written in order to move forward. Because if we can't see all of the things that are linking together, and your book is talking about one specific corner of living, right? This is the drug thing that we're addressing and that we want to be able to talk about. But really, when I used because I didn't like myself and because I was harming myself. And so when I saw that, oh, you want to harm me as well, that just reinforced the idea that I was worthy or I was deserving of pain.
You deserve to be hurt, right? And that is, self-hatred is such a huge part of addiction for almost everybody who has it. It gets people at risk in the first place, And this is often why people who have trauma histories or mental illness or some kind of outlying temperament that makes them feel weird, all of this is why people are using. And if you're just like, we'll make it worse and that'll make it stop. Well, hello, addiction is defined by all of our government agencies and anybody who's looked at it long enough as compulsive use or compulsive behavior that continues in the face of negative consequences. So if negative consequences was going to fix it, then how would it exist in the first place? And nobody is able to answer that for me.
But this is not just happening in the world of drug use, right? Like, I mean, I just got off the phone with Ken Bain, who wrote Super Courses. It's a book on education and teaching and learning. And he's talking about like how we have done that same thing in our education system with our grading system. It's like, oh, look, you're on the bottom. Don't you want to be on the top? And everyone's like, well, what if I just don't fit into that mold? And we do this. We have this whole system of, oh, you are the boss and I am the worker and this is the way and you are on top. And everywhere we are continuing to cause harm.
Yeah. And I mean, as somebody who often takes a biological perspective on things, I think entirely rooting out status differences would be hard. But can we get a ton better at like minimizing those distances and minimizing the harm done by status stress? Oh yeah. And I mean, like there's a whole field of research on this where it shows that like the more unequal a society, the greater the amount of addiction and all kinds of chronic ill health, obesity, heart disease, lack of exercise, all of these things are linked to how unequal a place is. And when you reduce that status hierarchy, you reduce the harm. And you can see this even in baboons, oddly enough. There's really interesting data on this. But yeah, it's like this is to me also why harm reduction is so beautiful, because it can be applied in all of these other areas, such as COVID-19. Like we expect people to completely abstain from socializing, which is completely absurd. We can't do that. Like fundamentally, biologically, we are wired to connect. Like we cannot, in fact, the reason that solitary confinement is so bad for your health mentally and physically is that humans are social creatures. We need each other to relieve stress. And human social contact relieves stress more than any of these other things like running or yoga or any of these things. Like, not to say that those things aren't good and not to say that people don't need alone time sometimes, but the biggest reducer of stress in humans is kind social contact. And so the idea that we can make people abstain from that completely is ridiculous. So we have to know what are the highest risk situations, how do we minimize the risk in those situations, but accept the fact that people are going to take risks to socialize because that's fundamental to life. Yeah. And this is where this virus gets us. This is where all viruses get us because then they can spread. It's kind of, I mean, this is a digression, but I think it's kind of weird how evil viruses are. There's these little things and all they care about, if they care at all, but all they want to do is reproduce. And regardless of the cost, even to themselves, it's just complete selfishness. And then it is able to attack a collective like we have, as however frayed that may be, because of our desire to connect. So I just find that interesting.
And you know, that's survival, and survival is not easy. Us as humans have made huge strides in making living easier. But once again, digression. And I also want to kind of point out, like, humans kind of act as a virus on this planet, just like.
Well, that's also true. That's also certainly true.
Again, digress. But so one of the things that keeps coming up with me in terms of harm reduction is like what we're trying to do is, of course, like reduce harm. But what? And this brings up Gretchen Bergman, who is a parent that is really trying to increase love for the situation. And that is something that I'm really intrigued about, because when you and I first talked, and I'm going to ask you this question now, like, how do you define harm?
Right, right. And I mean, that is a very, very complicated issue. I mean, I tend to just look at it from a very crude way, like don't kill somebody. Like HIV is more harmful, but when you get down to the finer gradations, it does become a little more complicated. So, for example, one of the arguments that abstinence people made for years against harm reduction as a form of recovery was that, like, well, if you're still kind of sort of using, then you're not getting the full benefit of the completely clear conscience and consciousness that you will have if you are totally gloriously abstinent. And so basically you're settling for something less.
Letting great be the enemy of good, right? Like
Yes, exactly. And so that really is exactly doing that. And harm reduction says, no, we can't do that, because that will mean A, that a lot of people will die, and B, that a lot of people who could have had good enough will have nothing. So it is really important to sort of think about this. And in harm reduction, it is essential to look at risks in context and to know what harms you're trying to reduce. So, for example, with the opioid crisis, we decided that, well, look, medical opioid use increased because of evil drug companies. So if we just cut medical use, we'll solve the problem. By doing that, we have made it 10 times worse. Literally, we have massively increased death. We have harmed pain patients. We have harmed people with addiction. And we have created a lovely, huge market for drug dealers. Mm-hmm. And this was completely predictable.
Yes. And what we also did was give a platform to drug companies to continue to try and push their products so that you can get people off the street and all of these things. So it's like, it has been such a cycle of, oh, this is going to get worse.
Right. And I mean, I think to me, the astonishing thing with all the Purdue pharma stuff mm-hmm. is just that it's still legal, as far as I can tell, to do exactly what they did. Mm-hmm. They were allowed to have sales quotas for people selling opioids. Why is that okay? Right. It just, to me, the real crime here is what was legal. Mm-hmm. And this is, of course, why they're getting away with the stuff that they did that was illegal, because it's just all this giant mess. And now you get the situation where we are so interested in sticking it to the drug companies that we're just abandoning people in pain and pretending that once people are on opioids, you better continue them or you might kill them. Right. That you're not going to reduce their risk of overdose by taking that away, because you'll probably increase it, because either they will get a illicit supply or they may become more disabled and despair and turn to suicide. So if you're not, again, it's like the same thing. We're taking stuff away and not providing anything else. Are there people in chronic pain who are on opioids who are not benefiting from them and could benefit from something else? Yes, but just taking the opioids away doesn't solve that.
And this on the other side, we legalized cannabis in many states. In my state, I'm in Illinois. We did, and there is no conversation about what that means. No conversation about hey, this is what, cannabis is not a silver bullet for everything that you there are things that go along with this. And there is no, we cannot be legalizing things and just being yeah, no, everyone's going to be fine. What are we doing? There's no conversation about what's next.
I think if we were going to do that with any substance, cannabis is a reasonable one to do it with. And, since we seem to insist on a realm of commercialization, then I'd rather it compete with alcohol because it is safer. That's not to say it's safe. And it's not to say that there cannot be harms associated with excessive cannabis use, because there obviously are.
I don't have anything against the cannabis legalization or anything like that. It's just, it is the policy behind it that just kind of states that is very hands-off, that is creating more harm than good in the long term.
So I would say that, the worst of all possible worlds is extreme prohibition. Right. The second worst is extreme commercialization. If you have to have extreme commercialization, marijuana is the substance to have it with. But it is still not good. And it is good to recognize that and to make sure that we keep in mind harm reduction for people who will end up having trouble with it. Now, will those people be better off having trouble with it when it's legal? I would certainly argue that they will, especially if they are people of color, because at least the problem won't be the cops. I think, and this is why I think one of the lessons of harm reduction is that we need to move towards decriminalization of everything and then deal with the issue of commercialization, because obviously there's a better place than having Philip Morris fentanyl as the form of legalization. What you want in terms of legalization would be controls on advertising, controls on times of selling, controls on places, all kinds of inventive controls that I haven't even thought of. But we need to be thinking about how do we actually reduce harm. And I mean, one of the things that's kind of interesting with this is tobacco, because by actually restricting the places where people can smoke, it turns out that makes the drug actually less addictive because you're not able to repeat it in as many settings. And so if you look at the proportion of people who are pack-a-day smokers now compared to then, it is much smaller, which is weird because you wouldn't think you'd be able to affect something as serious as the rate of addiction to something by environmental controls. But this was done without illegalizing it. And so I think there's interesting lessons there. And obviously, when we are looking at how to manage drugs and reduce harm, we have to look at set and setting, where people do it, how they do it, what the alternatives are, and so forth.
Right. And, and as you say, commercialization, there was lots of marketing around like anti-smoking ads and other things like that. And those were mandated, right? Like those were created because of what we had learned from, what the tobacco industry finally admitted, right? Like, oh yeah, we are kind of addictive.
And I mean, that, and it's interesting. I just wrote a piece for Scientific American about opioids are not cigarettes, and sort of saying that, trying to use that model in a very strange way, because like we didn't make cigarettes illegal. We didn't cut off the supply from people and then assume there would be no black market. In fact, what we did was all these other things because we recognized otherwise we would have a huge black market.
Right.
But that is not how we proceeded with opioids. And the idea that we have to demonize these substances that some people need, especially at end of life, is, it just ends up doing more harm. So figuring out what the most harmful outcomes are and measuring those and looking at those, and also figuring out what the positive outcomes are. Like, are people having a better quality of life? Are people dying? Are people, getting jobs? Are people being there for their families? Because if we improve those things, I don't care if you're getting high. Like, if you are productive and compassionate and together and all of these things that we want to be, why should we care?
Right. And I think that's something that your book really points out, is that, hey, there isn't a silver bullet here. And people are going to find their way if you give them space and respect to do that.
Yeah. And I mean, the thing that is both remarkable and sad about it is that it's sad that it took needle exchange for us to realize that if you're kind to people, they start to be better to themselves. I mean, it's sad that it is like when you go and you see harm reduction in action and you see these people who are the despised people of the earth being treated with respect and suddenly coming alive in a way that they weren't previously. It's like, why would we think that being cruel and exclusive towards people is going to help them?
Right.
Like, it just, and so, I mean, it's interesting because with everything else, like, we recognize that like abusing children isn't good for them. We recognize that, war is bad for people. we recognize that trauma is not a good thing. And yes, sometimes people grow after trauma, but we don't think that, yeah, let's put people in car accidents so they can have post-traumatic growth. Like, but that is how we think about people with addiction. We think of them as non-human beings who the only thing that will get through to them is force. And when we dehumanize people like that, it is a recipe for disaster. And I guess I'm sensitive to this in part because my dad was a Holocaust survivor, and being Jewish and experiencing all of the, well, not all of the, but experiencing some of the way that can be isolating and rejecting. And then experiencing the true horror of being seen as a person who's completely worthless because I inject drugs and I'm so worthless that I will simply be left to die, even when they could teach me that bleach would protect me, but we'll just let them die so they'll be an example. So why aren't you putting me on a bed in the middle of the street so the kids can see me? How am I going to be an example dying in a corner somewhere? Anyway, this is silly, but but that's what, it's like you have to make explicit the absurdities.
Yeah. I mean, you have to, even though you're not, like, we need to be able to exaggerate a little bit to clarify what the hell is going on, because our entire criminal justice system is against, well, not entire. I'm sure there are counties out there that are for this, but they do not want counselors and clinicians and individuals who are trained in drug and domestic abuse and all of these things to be there. They're just like, we'll handle it.
Yeah, I mean, I think that the, hopefully, in another 50 years, we'll see the whole idea of incarceration as being barbaric. I think we're far from there, and there's certainly people I would like to see locked up, even though I recognize this is an atavistic instinct that I should not indulge. I'm sure you can imagine who some of those people are, but I think really it makes absolutely no sense to have police respond to mental health or addiction things. Like, let's just leave out violence for now. Just focus on this. Like, why on earth would you send somebody who's armed to deal with somebody who's going crazy and is paranoid?
Mm-hmm. And this is where harm reduction needs to take us ultimately.
Right, exactly. And I mean, this is why so many people in the prison abolition movement and the in Black Lives Matter and all of this have adopted harm reduction and realized that they had practices that were doing that before harm reduction was named, that are indeed harm reduction. And to see that, it's just great to see, because while we've been talking about all the depressing aspects of this, the thing that this book really showed me, and researching and writing it really showed me, is that we have actually come a long way. And we need to go a lot further. But when you are doing the day-to-day work of trying to help people with addiction, trying to do needle exchange, trying to do whatever harm reduction work you're doing, it can be easy to despair because you can't see the difference you're actually making. But if you look at it 30 years down the line, we actually have made a big difference. And it's, we still have a very, 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 very long way to go, but it's important to see the progress so that we do not become demoralized.
I had released this little clip from my interview with Ken Bain, and he had said, "We provide more punishment for those who try and have not yet succeeded than for those who don't try at all." And the thing is we're trying. We're out here, and harm reduction is out there, and it is making waves finally. And even though those waves are still trickles, they are going to, as increasing numbers of people kind of get treated with respect. And that's all harm reduction is. In my idea is just look, treat this person with respect and you are reducing harm.
Right. And that is exactly true. Whether they stop taking drugs or not, no matter what, if you are treating somebody with respect and dignity, you are reducing harm in the universe. And that is a good thing. And often, though, it will have knock-on effects on that person being able to be less harmful to themselves and others.
And that's why we practice harm reduction, because the thing is especially in the drug and alcohol world, utilizing is self-harm, is practicing things that are not healthy for us. Like, we don't like ourselves to the extent that we will harm ourselves. And
I mean, I think our treatment field has unfortunately selected for people who enjoy harming other people. And that's not to say that there aren't very many wonderful people doing great work in the field.
of course,
But when you have a field that has long had the ideology that hurting people helps them, you are going to attract a kind of employee that most people would like to avoid.
mm-hmm. Yeah, when so many of our counselors and clinicians are coming out of addiction themselves, and they are only at the point, when they start their job, they're only finding the point of like, oh, I stopped from shame, so I'm going to make sure that you feel enough shame that you will stop. And it's like, whoa. You haven't healed shit yet.
Well, and I mean, I think, people in recovery are an enormous resource for helping others recover.
Mm-hmm.
And we need to do everything we can to educate them and pay them well and support them and all of this good stuff. But you are not an expert because you have 90 days of abstinence in 12-step programs.
Right.
That does not make you an expert. You may have 10 years of abstinence in 12-step programs. And if you haven't read the research literature, if you haven't talked to people who work in other modalities, if you haven't familiarized yourself with the psychology literature, with all of the things that have to do with comorbidities that are more common than not, you're not an expert. And so the best experts have both experience and research and the ability to move between those perspectives and understand how this all comes together. But if you just dismiss all of the empirical evidence in favor of your personal anecdotes, then you are going to end up harming people.
And we do that more often than not, unfortunately, because we're not necessarily aware of how much our perception changes. It affects how we see the world.
Right. I mean, I think the fundamental problem is people don't know what they don't know. And I'm as guilty of this as anybody, because you just don't know what you don't know. But when I was in early recovery, I was, very gung-ho abstinent because I was told this is the only way, this is the best way, the only alternative is jails, institutions, and death. I was told all that in what seemed like a mainstream medical institution. So I figured that there had to be data that backed this. And I remember, like, in the rehab, they would tell me things like, oh, only 1 of 37 recovers. And so I was writing a story, I guess maybe a year or so after that, and I called them up and I said, can you give me the source for that statistic? Of course they couldn't, because they just made it up. And like, it just, when I started actually oftentimes arguing online with researchers because like what they were saying was so different than what I'd been taught, I started really getting smacked down and realized that, like, wait a minute, like, there's a whole other perspective here. And I may still disagree with some of it, but I need to engage with it. I need to understand what it's saying. And I need to recognize that as a person with addiction, I have one limited perspective of my own. I might, hear thousands of stories in a particular framework, or I might go and interview a few hundred people and try to get them to explain their framework. But the thing is, unless I engage with both the qualitative and the quantitative literature, I'm not going to be able to have as full an understanding as is possible. And I want to have that understanding because we're all different. And I think one of the biggest harms in the addictions field has been this one size fits all thing. This idea that, like, if it worked for me, it works for you. And that's just, we don't say that about any other condition. Like, if you're talking about depression, if you're talking about cancer, like, you don't have people going around saying, oh, those people who do chemo, they're not in real recovery from cancer. Only the radiation folks are, I mean, like, that just, it's laughable because it's funny, but this is like how we behave around addiction. And we behave as if like, I can speak for all white, red-haired women across the universe. Like, but if I say I speak for all people with addiction, I'll be believed in a way that I wouldn't be if I said I spoke for all like white-haired, red-haired, whatever women.
Might be white at some point. It's all right.
Yes. I just like, right. I mean, if I say I speak for all women, they would totally laugh at, they should laugh at me. But if I say I speak for all people with addiction, they should laugh at me too. Right. I can hopefully at this point, after studying it for 30 years, give a more informed perspective than I would have done 30 years ago. But,
the interesting thing about that is even though you studied it for 30 years and you can give a more informed decision, you have come to a place in your research that says your informed decision is still yours and you understand that. And that is the depth of that is the depth that we want to be able to dive into our understanding of things, is to understand that like no matter how much I know, I still only know what I know.
Right. And also I can try to teach you some stuff, but I may not be able to convey it in a way that reaches you, or you may not be ready to hear it, or whatever it is. Yeah. Your experience is valid and you have to come to your own stuff. I just think that in a world of policymakers, we want the policymakers to have the maximum information synthesized within themselves before they go around making pronouncements.
Yeah. And like this concept of like just understanding that you know what you know and you are presenting this from your place, that's harm reduction.
Yeah, no, and that's very true. And I must say that like, I definitely still have the impulse to say, I know I'm right. But what are you going to do? We're human.
That's right. No. And as long as we walk away from that instance of us being like, I'm right, and say, let me process that. Whether I say I'm right or not, like, yes, there's a thing there. But if you're determined, well, then continue growing. Like make sure that we go back and reassess what we said, what we did, how we responded, and that's harm reduction.
Yes, absolutely. And I think as a scientist, I am not a scientist, but if I were a scientist and I like to think in a scientific way as much as possible, they always talk about question your priors. Like, you'll immediately believe a study that like affirms what you already think, but you're going to avoid the ones that challenge that or try to explain them away. And you have to be aware of that tendency and look at the study that makes you annoyed and be sure that you are, at least as far as you can tell, not just using confirmation bias. Yeah. But, it is hard. And there are certainly instances where, for example, needle exchange, I know that reduces harm. Anybody tries to tell me otherwise, they just don't have the data to support it. And they can make up, whatever, thought experiments or, statistical like hand waving to like say otherwise. But when you look at what actually happened at the entire public health literature, it's like.
And once again, doing a needle exchange is just treating somebody with some motherfucking respect. That's it.
Exactly. It's saying that you deserve to live. You deserve to have the equipment that you need to protect yourself. And we may not like what you're doing, but who cares?
Who was it for me to say?
Yeah, exactly. Right. And I mean, I think like that humility, which is a value that is supposed to be in 12-step, but is often not, but that humility is really important. And, it's like one of the things that I tried to make clear in the book is that you can both be a fully committed 12-step person and be a harm reductionist. Like they do not have to conflict. There are certain ideas within them that will conflict, but overall, harm reduction does not say no one should be abstinent. Harm reduction does not say the 12 steps are terrible and you should never try them. It basically says, we're going to meet you where you are. Let's help you find what works for you. And that could be 12 step, or it could be something completely different.
Yeah.
But, sort of recognizing that it's not necessarily a conflict, and that all forms of recovery can thrive, even though it may be very difficult for somebody who's in abstinent recovery to deal with people who are in non-abstinent recovery, because it feels threatening to them. That is something that can be managed. It's not a reason to say that, well, this one's right and this one's wrong, and we can never allow both.
And in my language of this idea of recovering too, it has no bearing on your using or not. It's always just about, can you move forward into a space of more respect for yourself and others? Are you recovering to something that you want to move towards? And that's so important, because if I left AA pretty soon after getting in it, because they told me I couldn't go to the jazz club. And I was like, no, I'm sorry, I'm 25. I'm going to a jazz club. And they're like, it threatens your sobriety and stuff. And I was just like, no, it doesn't threaten mine. It may very well threaten yours, but I can't live your threats for you. And that's something that just kept popping up. And I was like, I'm just going to step away and I'm going to get clean on my own. And I did. But it was, that's just because 20 years ago, the game was a little different. But it was so important for me to leave the environment that told me I had to do it one way. And so my entire recovery has just been like, I don't care how you do it, but if you want to do it, do it. Like there's stuff out there, and you can swing a dead cat and find some help. Like, so let's do that.
No, and I mean, it's funny because there are threads within AA that are completely the opposite of that. For example, I remember early in my recovery, I was insistent on going to Grateful Dead shows, and I was fine. I just ate chocolate. The chocolate was good. And I listened to the music that I love. And there's a group called the Wharf Rats, which, if you know the song in the Grateful Dead song, is about a hopeless person with alcoholism, and thinks about redemption. Anyway, there's this group. They're sober and 12-step, and they're at the Dead shows, like supporting people so that they don't relapse. And then there's that AA story of the guy who runs a bar and is in AA. Mm-hmm. And I think what's interesting about all that, in my own early recovery, I was just like, no, I am not going to give up music. I am not going to give up things I love because I'm giving up drugs. Like, that makes no sense. Yes, I'm going to be careful, because I certainly understand that, if I'm going into a place where people are using a lot of drugs, I could be at risk to use drugs. But the music mattered to me. And so I wanted to, hear it and be a part of that community. And there are ways to do it. But yeah, like when people just tell you, you have to do it this way, that's that. Yeah, it is harmful. And, I think it's certainly fine to say, well, okay, I was just like you. When I went to a jazz club with 2 days sober, I didn't stay sober. Right. But that was my experience. Your experience may be different. But that's the way AA is supposed to work. And of course, supposed to and actual happens in practice can be very different. But I think, sort of understanding that there's multiple paths, and that what works for you is what works for you, and that's fine, is really critical and really a fundamental part of harm reduction too.
And understanding, like, as you're going through your own recovery, like understanding when you say what works for you, what works for you, like understanding what does it mean to work for you? What does it mean to grow within your recovery? Whatever that means. If that means that you don't stop anything, but you start to build a life that you want to be in, not that you want to escape. Like, and that's harm reduction. That's just respecting yourself.
Yeah. No. And I mean, I think, all of this stuff can get complicated, especially because we can delude ourselves sometimes.
Oh, yeah.
But it's when you treat people as though they are fully functional humans who can make choices, they are much more likely to make choices than if you tell them that, like, no, you're a zombie robot that like only responds to drugs.
Right.
And you have no free will until you're abstinent. Like, no, that's just not true. And then this is also why needle exchange was so threatening, because you weren't supposed to be able to make positive changes when you were actively using, and you can. And that matters. And that may be part of your path to abstinence recovery or non-abstinence recovery. Like, it just, but yeah, just this whole limiting thing and seeing it as all one thing is just not helpful.
Not helpful and harmful. And we are trying to reduce harm. Maya, thank you so much. I really enjoyed talking with you. So much stuff is in this.
Yeah, this was a very wide-ranging conversation, but fascinating. I hope this was useful.
Treating people as if they are incapable of making the right choice does harm. Telling people that you know what they should do and that you have a better solution for their life causes harm, no matter what your intention is. This is not to say we don't delude ourselves at times, but even when we delude ourselves, we will course correct. But that can only happen when we trust, love, and respect ourselves. And we can more easily achieve that if we are shown trust, love, and respect from others. That is harm reduction. I want to thank Maia for joining me and encourage you to get her new book, Undoing Drugs, The Untold Story of Harm Reduction and the Future of Addiction. You can find the link to that and everything Maia is up to in the description of this episode. Please rate and review this podcast and or leave comments for this episode to help me better create helpful content. Support this show at anchor.fm or support me and my work at Patreon, where you will get access to unedited content as well as access to supporter group portrait sessions with me. I host workshops regularly, which are both open to the public and a source of continuing education units for professionals. I also take a number of limited one-on-one clients every month, so contact me when you're ready to work together through MartinJon.com. I also accept financial support through Venmo at MartinJon_Garcia. So if you benefit from listening to this content, please consider supporting my efforts. Thank you for listening to the Recover Yourself podcast. Until next time, keep recovering yourself.